Rheumatic fever. The best treatment options. Rheumatic fever is a rare but serious complication that can develop if a group A streptococcus throat infection is not treated. There is no cure for rheumatic fever, but treatments are available to help relieve the symptoms. Symptoms of rheumatic fever include high temperature, fever, of or above 39°C, 102°F. Blotchy red skin rash. Headache. Nosebleeds. Fatigue. Excessive sweating. Chest pain. Shortness of breath. Abdominal pain. Vomiting. Joint pain and swelling, often begins in knees and ankles. Irritability. Shortened attention span. Changes in personality, moodiness, unusual laughing, crying. Small nodules under the skin. Symptoms typically begin 1 to 5 weeks after a bout of strep throat, although in some cases the infection may have been too mild to have been recognized. Sometimes, people with rheumatic fever do not recall having had a sore throat. Rheumatic fever can also cause a temporary nervous system disorder. Today it is called chorea, or synonyms chorea. This is a nervous disorder characterized by rapid, jerky, involuntary movements of the body occurring mainly in childhood or during pregnancy and closely associated with rheumatic fever. It may appear up to 6 months after rheumatic fever has cleared. People with mild cases of chorea may find it difficult to concentrate or write. More severe cases can cause the muscles of the arms, legs or face to twitch or jerk uncontrollably. The knees, ankles, elbows and wrists are the joints most likely to become swollen from rheumatic fever. The pain often migrates from one joint to another. However, the greatest danger from the disease is the damage it can do to the heart. In more than half of all cases, rheumatic fever scars the valves of the heart, forcing this vital organ to work harder to pump blood. Over a period of months or even years, particularly if the disease strikes again, this damage to the heart can lead to a serious condition known as rheumatic heart disease, which happens in up to 1/3 of cases and can eventually cause the heart to fail. Causes of rheumatic fever. Rheumatic fever results from an inflammatory reaction to certain group A streptococcus bacteria. The body produces antibodies to fight the bacteria, but instead the antibodies attack a different target, the body's own tissues, so it is a type of autoimmune disorder. Rheumatic fever diagnosed. Looking for rash or skin nodules, which are hard bumps beneath the skin. Listening to their heart to check for abnormalities. Performing movement tests to determine their nervous system dysfunction. Examining their joints for inflammation. Testing their blood for strep bacteria. Performing an electrocardiogram, which measures the electric waves of their heart. Performing an echocardiogram, which uses sound waves to produce images of their heart. Effective treatments for rheumatic fever. Anti-inflammatory treatment. Anti-inflammatory treatments include pain medications that are also anti-inflammatory, such as aspirin or naproxen. Doctors may also prescribe a corticosteroid to reduce inflammation. Anticonvulsant medications. Your doctor might prescribe an anticonvulsant if involuntary movements become too severe. Bed rest. Your doctor will also recommend bed rest and restricted activities until the major symptoms like pain and inflammation have passed. Strict bed rest will be recommended for a few weeks to a few months if the fever has caused heart problems. Synonym chorea. Medication may be recommended if the episodes are severe. Medicines originally designed to treat epilepsy, such as carbamazepine and valproic acid, are usually effective in treating synonym chorea. Home remedies. Mint tea. Have mint tea twice a day. It will help keep the internal system cool and thus reduce body temperature. It also helps extract excess heat from the body. Ginger. Ginger is very effective in curing any kind of allergy or disease. Add some honey and lemon juice to ginger paste and have it while the stomach is empty.